all about salivary glands. Let's make it easier for the NEET PG exam. First, log the three major glands: parotid, submandibular, sublingual. Quick memory line: PSS, parotid, submandibular, sublingual. Types of secretions. Must tested basic fact. Parotid is purely serous. Submandibular is mixed but predominantly serous. Sublingual again mixed but predominantly mucus. Best mnemonic: PSS once again. P is pure serous. Submandibular is semi-serous. Sublingual is slimy. Or parotid pores protein. Sublingual secretes slime. Yes, extremely sticky. Next, ducts and opening the must knows. Parotid duct. Stenson's duct opens opposite the maxillary second molar. Submandibular duct, Wharton's duct, opens at the sublingual papilla besides the frenulum. Sublingual gland. Many small ducts is equal to ducts of Rivenus, sometimes a major duct called the Bartholin's duct. Mnemonic: S for Stenson, side of the second molar. W for Wharton, under the tongue. Ultra short: parotid, Stenson, upper second molar. Submandibular, Wharton, floor of the mouth. Sublingual, Rivenus, many tiny openings. Next, parasympathetic nerve supply. The biggest MCQ trap. This is where students get confused the most. Parotid gland. Parasympathetic supply, glossopharyngeal nerve, which is your cranial nerve number 9, via the tympanic branch, lesser petrosal nerve, otic ganglion, and the auriciotemporal nerve. Mnemonic: parotid is 9 to 9. Cranial nerve number 9, otic ganglion, carried by the auriculotemporal. Or parotid prays to number 9. Submandibular and sublingual gland. Parasympathetic supply, the facial nerve, which is your 7th cranial nerve, via chorda tympani, lingual nerve, submandibular ganglion. Mnemonic: submandibular and sublingual are sisters supplied by 7, or chorda plus lingual is equal to floor of the mouth glands. One line exam saver. Parotid is equal to CN9. Submandibular plus sublingual is equal to CN7. This one line alone solves so many MCQs. Histology, the easiest way to differentiate. Parotid, pure serous acini, long intercalated ducts, adipose tissue is common. Memory, parotid is equal to protein plus pink plus fat. Submandibular, mixed glands, mostly serous. Serous demolunes are seen. So what is the memory? Submandibular is equal to balanced mixed gland. Sublingual, mostly mucus acini. Few serous demolunes, pale staining appearance. For memory, sublingual is equal to pale and slimy. Histology comparison shortcut. Parotid, dark serous fatty. Submandibular is mixed. Sublingual is pale and mucus. Mnemonic: parotid dark, sublingual light, submandibular in between the two. Which gland contributes the most saliva? Favorite MCQ. At rest, submandibular gland contributes the most saliva. And on simulation, parotid contribution increases significantly. So what is the easy line? At rest, submandibular. In rush, parotid. That's very exam friendly. Next, which gland gets stones most commonly? The most common site of silolithiasis, submandibular gland or the Wharton's duct. Why? Saliva is more mucus, duct is long and tortuous, flow is against the gravity, more alkaline and higher calcium levels. Mnemonic: submandibular makes the stones because it climbs uphill. This is one of the best memory hooks. Salivary gland tumors, high yield clinical points. Most common salivary gland tumor, pleomorphic adenoma. Most common site, parotid. Most common malignant salivary gland tumor overall, often taught as mucoepidermoid carcinoma. Most common malignant tumor of the submandibular gland. High yield to think adenoid cystic, mucoepidermoid differential, but exam stem matters. Golden memory line. Parotid loves pleomorphic adenoma. Important tumor pattern shortcuts. Parotid tumors, most are benign. Smaller glands, higher chances of malignancy. How to remember? Smaller the gland, scarier the tumor. This is a very useful concept. Next, facial nerve relation, very high yield. Facial nerve passes through the parotid gland but does not supply it secretomotorily. This is a classic trap. We'll discuss the traps at the end. Memory. Facial nerve crosses the parotid, but glossopharyngeal controls the secretion, or it passes through but does not power it. This is one of the most repeated confusions in your exams. Next, myoepithelial cells. These are also tested. Function helps in expelling the secretion from the acini or the intercalated ducts. Memory, myoepithelial cells squeeze the saliva out, or they are the milkmen of salivary glands. Next, serous demilunes, high yield histology trap, seen classically in submandibular and sublingual glands, not in pure parotids. Memory, demilunes belongs to the mixed glands. Next, minor salivary glands, quick recall, found in the lips, cheeks, palate, tongue. Not on the anterior hard palate midline, not seen in the gingiva and the anterior hard palate. Remember, so the useful line being, minor glands are almost everywhere in the oral mucosa except gingiva and most of the hard palate midline zones. For the MCQs, remember the common teaching trap. No minor salivary glands in the gingiva. Quick physiology recall. Functions of the saliva: lubrication, digestion, buffering, cleansing, antimicrobial action, remineralization, and taste felicitation. Remember, saliva lubricates, digests, buffer, protects, cleans, and repairs. Best high yield relations: parotid gland contents with the relation. Important structures in the parotid: facial nerve, retromandibular vein, external carotid artery. Memory, nerve, vein, artery in the parotid. Some students remember superficial to deep as the NVA, nerve, vein, artery. Very useful in surgery based MCQs. High yield gland by gland crash revision. Parotid, yes, largest major salivary gland, purely serous, Stenson's duct, opens opposite the upper second molar. Parasympathetic, cranial nerve number 9. Facial nerve passes through. Most tumors occur here. Mumps are classically affected. Memory sentence: parotid is the biggest, purely serous gland with Stenson's duct, 9th nerve supply and facial nerve passing through. Submandibular, mixed, mostly serous, Wharton's duct opens near the frenulum. Parasympathetic, cranial nerve number 7 via the chorda tympani, largest contributor at rest, most common gland for stones. Memory sentence: submandibular sits below, secretes mostly at rest, uses the Wharton's duct, is supplied by 7 and forms the stones. Sublingual, smallest major salivary gland, mixed, mostly mucus, multiple ducts of the ravinus. Parasympathetic, cranial nerve number 7, floor of the mouth gland. Memory sentence: sublingual is the smallest, palest, most mucus major gland with major little ducts. Now comes the exam trap bundle. Remember this and keep going through again and again. Trap number 1. Facial nerve is inside the parotid, but secretomotor is cranial number 9 and not cranial nerve number 7. Trap 2. Submandibular gland contributes most saliva at rest, not the parotid. Parotid is on stimulation. Trap 3. Most common stone is seen in the submandibular, not the parotid. Trap number 4. Most common tumor is pleomorphic adenoma, usually in the parotid. Trap number 5. Parotid is purely serous, no mucus acini. Trap number 6. Sublingual is equal to predominantly mucus, not purely mucus in all descriptions, but predominantly mucus. The best oral chant for all students appearing for NEET. Say this daily. Parotid pure serous Stinson 9th nerve. Submandibular mixed mostly serous Wharton's 7th nerve. Most saliva at rest, most stones. Sublingual mixed mostly mucus, ravenous, seventh nerve. The facial nerve passes through the parotid but does not supply it. This is very easy to revise repeatedly. Hope that helps. Don't forget to save it. Don't forget to share it. Let everyone benefit. Take care.